So, my name is Angela Owens with Phenomenal Business Solutions, and I provide bookkeeping and accounting services and business advisory services to small businesses. And today we are going to be introducing you to health sharing. It's not health insurance, it's health sharing. And I have the lovely Courtney Carpenter with me, and she is definitely going to help us to understand more about this and different ways that you can um, get your health care taken care of. So, Courtney, would you introduce yourself?
Absolutely. And Angela, thank you so much again for letting me jump on today with you guys live. Like Angela said, guys, my name's Courtney Carpenter. I represent a company called Impact Health Sharing. We'll talk all about what that is in the industry, but I actually have a background as a nurse. I used to be a pediatric nurse, and so I've had a background in healthcare for a long while.
All right. So, what is health sharing and how does it differ from traditional health insurance?
Yeah, absolutely. So a lot of people have heard of healthcare sharing. Maybe they don't quite realize it, or maybe they do recognize it right away. But healthcare sharing as an industry has been around for 40 years, and it is a non-for-profit approach to traditional health insurance. So it is completely different. It works just like normal health insurance does, where people have a healthcare card, you are a part of a certain company. There's a bunch of different healthcare sharing companies out there. And the way it works is there's a big pool of community. Right now, there's over 1.7 million healthcare sharing members in the US. So there's a huge market for it, but a bunch of different companies are out there. And each company is a big pool of people that it's basically a bunch of people coming together and paying each other's medical bills. But it's really great technology. It works and feels just like normal health insurance. And so the ways that it's different is people typically pay about half the cost of traditional health insurance for a share program. That's one of the really big benefits is that whether you're a business owner, if you own a dealership and you have employees, you can offer health sharing. It's less expensive for you guys. It's really good for the family or the person that would want coverage. And the kind of the caveat with healthcare sharing is that they're able to make it half the cost because it's really made for people that are healthy or fairly healthy. So that's a little bit about the industry. And if I can share, Angela, the reason why health sharing started, it actually started about 40 years ago. And it started in Christian churches and communities as a way to fight the costs of healthcare coverage for like pastors and deacons and people that were a part of the clergy across a bunch of different denominations. They wanted to give their pastors and their families affordable healthcare. And then a bunch of companies kind of sprouted from that original idea. And so for a long time, healthcare sharing was only available to people that were a part of Christian churches. And a lot of other people started catching on after they surpassed, million members just in the US alone and said, hey, what if we take this model and we expand it to all different backgrounds, all different religions? And that's exactly what they've done in the industry. And I believe it's going to be one of the fastest growing industries, not only within the healthcare sphere, but in general.
Okay. And so, how can health sharing programs benefit like employees and business? Do y'all have like group health type of things?
Yeah, absolutely. So, there's individual plans, just like normal health insurance. If one person or one family within a company wants to come on with a health sharing plan, they can. Again, it's typically about half the cost when you look at averages. So it's a lot of savings. And then also for groups, as long as it's under 50 employees, so 49 and under, companies can offer it as just a separate plan than health insurance. This is really good for dealerships or companies, small businesses that are not paying for their employees' healthcare. A lot of times it's like people want to opt into, maybe a Blue Cross plan or maybe a Humana plan or Cigna, but it can be, half their paycheck just coming out from healthcare alone. And so it's really great to kind of bridge the gap between people needing coverage and feeling a little hopeless because they're like, well, the plan that my employer's offering is going to eat up most of my paycheck. I can't even pay for this. So there's both. And we work with businesses all over the country to be able to offer really specific solutions for them and their company.
Okay. And what types of medical services and treatments are covered with health sharing?
Yeah. So just like normal insurance, whatever company you're with for the health sharing group, again, there's a bunch of different, amazing ones out there. They will have basically a full guideline of everything that's like, covered or not. Typically, this is going to be the exact same as, traditional health insurance. So if anything major happens, traumas, of course, like ER visits, surgeries, maternity, if mothers are giving birth, or NICU stays if their babies need it. Any of those big questions, whether it's the tiniest expense like just a wellness checkup or like some routine lab work, all the way up to bigger traumatic events that can be hundreds of thousands, if not millions of dollars in medical billing. That's all within the spectrum of things that are covered. And so whoever is, for anyone that's looking at a health sharing plan, get with the person that's helping you and have them really sit down and explain all of the different details and nuances, because it varies from company to company, but it's pretty much identical to what health insurance covers as well.
Okay. And how does the claim and reimbursement process work?
Yeah. So great question. So this varies a lot from company to company. Some
Okay.
health sharing companies, this is typically the ones that are still that only take people that are of a Christian background. For most of those, the way that it works is you have to pay out of pocket for whatever expense you may need, whether it's like an appointment, if it is some type of surgery or some type of preventative procedure, whatever it may be, prescription, they have to pay either all of it or a percentage of it up front. And then quickly, the health sharing company will then reimburse them in cash for whatever procedure that they had experienced. The way that my company works, Impact Health Sharing, everyone has a different primary responsibility amount. What that means is it's just like a normal deductible. And people, once they hit that, deductible for the year for the family, Impact will kick in and pay, the eligible medical bills after that. And it works with people have a card. And just like if you have a normal insurance card and you go to the doctor, you have to go to the ER, you hand them the card, you pay whatever copay, $50 that day. And then the hospital or the doctor bills the health sharing company. So that's really where there's a lot of great groups out there that are really combining great healthcare with really good technology and making it a pretty seamless thing where it feels and it works just like another company they would be used to with traditional health insurance. So there's been I prefer that type of experience for people. Being in healthcare, one of the things, we had a few people that would come through that would be on health sharing programs, some of the more traditional ones. And again, all the companies are great. There's just pros and cons to each style. But we'd have some people that would come through and they would be, faced with having to pay some pretty expensive things up front. And the way that the newer health sharing model works, it really alleviates any burden of the reimbursement process. So that's
Yeah.
really where, it's pretty unique.
Okay. So, is there any restrictions or limitations with pre-existing conditions?
Yeah. Again, that's a great question. It's something that comes up the most often is health sharing is made for people that are fairly healthy or healthy. So of course, we live in America. Most people have, different things going on, whether little chronic issues or they're taking prescriptions for certain things. That's typically not going to be an issue. It's more like, big surgeries that have happened in the past couple years. If you have any upcoming really big surgeries, cancer diagnoses, anything like that, that's going to be a really major case. The health sharing companies take it kind of person by person, but typically the reason why they're able to keep costs so low and allow, people to pay typically about half the cost versus health insurance on their monthly premium is because they really are more selective with the people that can actually come on with a share program. So it's always case by case, but The way that the company that I'm with works is anything that's been diagnosed or that's being actively treated in the past 36 months, that is what's called a pre-existing condition.
Okay.
And sometimes, there are lots of different programs, again, within a health sharing program, where, there's prescription savings. If you guys are familiar with like GoodRx, there's
Yeah.
similar programs within health sharing groups that can really, significantly reduce the cost of prescriptions, where sometimes people will bundle a health sharing plan. It could be as low as like $70 a month for a health sharing plan with their insurance, just because their prescriptions with a share plan may be, $100 cheaper a month than with health insurance. So there's all kinds of little ways that we can work with people, but it's typically case by case. For people that do have pretty, significant chronic issues, we always recommend to stick with health insurance. And one thing with that too, Angela, with companies is when we come and explain health sharing to, let's say, a car dealership or a roofing company, a real estate team, or whoever the group may be, a lot of times it'll be us talking about the share program, and then we'll work with an insurance broker, whoever may be already there, or someone that we can bring in. We have lots of great partners where we give the employees the option, hey, if health sharing, if you like this, if it's a good fit, we can get you set up on this plan. And then for anybody else, they can get set up on a really good health insurance plan. It saves the business owner, it saves the family, and then it allows people to choose. That has been super, super helpful. A lot of the businesses we've worked with, they have come back to us and said, my employees are like my second family. Every business owner, you know this, Angela, you work with businesses all day long. They want to take care of their employees.
Yeah.
And for them to help people save money, it saves their, adds money to their bottom line as the business owner. It's a really good partnership where their employees come back so many times and say, thank you for bringing in an additional option and being open-minded, because this was a huge blessing to our family. I'll give you one quick story with that. There was a family, I'm here in Texas, and there was a family in Texas. The husband owned an insurance business and the wife was a realtor, and they had two healthy kids. And both of their, they're both 1099, they're self-employed people, and they run their own businesses. But with both of the companies they ran their businesses with, the health insurance options just were really, really slim, and they were paying the premiums. They got referred to me last year, but we saved them about $1,800 a month by switching to a health sharing plan. And that was $21,000 that went back into that family. And that, as an accountant, like for a family, that money can be allocated to so many different things. So that's really what's exciting, is we get to take it case by case, whether someone's self-employed or if they're W-2 employees with an employer.
So when you have a business, when you're talking with a business and they have these employees and different people have different health conditions, or their family members may have different health conditions and situations like that, how does the plan work for them?
Yeah. So people that are pretty medically complex, again, health sharing is probably not going to be the best option, and that's totally okay. A lot of times with families, for example, you asked about, what about someone that has a family member it wouldn't be a good fit for them. We work with families where maybe we keep maybe one of the children, if it's the children that is a little more medically complex, or maybe it's a spouse, or maybe it's the employee themselves, whoever it may be. We do this a lot where one person will stay on health insurance, and then maybe two or three or four people in the family can jump on a share plan. Because that's still, going from one person paying health insurance, or from like five people paying health insurance to one person, and if the others are fairly healthy, that significantly reduces the cost. And
Yeah.
it keeps that one person still on a health insurance plan. That's where it's exciting, because really each family has specific needs, of course. And that's really the best when businesses bring us in to present to their employees. We really sit down with each person and go over the options for them.
Um, just pulling this out the dark. So let's say, a woman, she's on the health sharing program and she has a baby, right? She wants her baby on the program. When the baby is born, do y'all have like an automatic enrollment, or y'all have to wait and see the baby's health? Cause like, let's say she has a baby and, there was no, like, during her pregnancy, there was no complications. But now the baby's here. Day one, baby's fine, but day two, you start noticing there might be some health issues with the baby. With the health sharing, like, probably not go through at that time, because when would she apply for her baby to be on the health sharing? If I'm making some sense, I don't
Oh,
know.
absolutely. And like, and side note, my background was NICU as a nurse. And so I love that you're talking about maternity and the babies because that's, that was my favorite, being in the hospitals. But yes, so each health sharing company has different like fine print about maternity. So as long as for a lot of them, I'll speak for because it's kind of a general blanket statement, but always look at the details of the specific company or plan that you would be with because it'll be really easily just spelled out for you to actually see the policy there. But for a lot of them, the way that it works is, as long as the mom is already a part of the share program, she gets pregnant, she has her baby. The as soon as she's pregnant, that counts as two people.
Yeah.
So the baby, of course, if the baby is born and then develops something, that's a new onset. Like that, they don't count that as like a pre-existing condition since the baby was just born. And so there are again, check to with the program that the person will be looking at. But NICU visits can be, millions of dollars. They're some of the most expensive for babies can stay in there for months and months and months and can receive all kinds of treatments and that is covered with the health sharing plan. So that's really where just see the details, read the fine print, have the person, just like with normal insurance, the person that's promoting it to you or maybe walking you through it, ask the companies and make sure. But that's something that has been really, really great is allowing moms to have that peace of mind and knowing like, hey, no matter what happens, if it goes really smoothly, maybe if things turn out a little differently with the baby or the baby needs to stay in the hospital, whatever that looks like, it's great to give them peace of mind like that.
And what happens if the member needs extensive or long-term medical care?
Yeah. So long-term care, which long-term care is a whole other topic in itself. I actually work with a gentleman, his name's Tom. He is phenomenal. For anyone watching the live or watching the replay, if you have health insurance or if you are a part of a health sharing or program or looking at either, I highly recommend to always get a separate long-term care policy. It's super inexpensive. I don't know if you have seen this, Angela, with some of your clients, but it's super inexpensive. Most health insurance plans and healthcare sharing, but normal health insurance, they have sometimes it's 30 days, sometimes it's 60 days, sometimes it's 90 days. That's pretty generous, but there is a cap where they will only pay for up to a certain point for long-term care, nursing facilities and that sort of thing. And I mean, we've seen people that it can be 10, 20, $30,000 a month for someone to be in a long-term care facility. It's a hard conversation because no one wants to talk about or think of themselves or other people in, that type of situation where maybe they are, bedridden or they're in another facility getting, receiving care. Maybe they have a caregiver. No one wants to think about that. So it's something that a lot of people avoid, but I always send our clients, at least to talk to Tom, who's the gentleman that he specializes in long-term care plans. It is a really inexpensive plan. Just you bundle it with your health insurance or health sharing plan, and that protects you or your loved ones for years and years and years down the road. So I highly recommend that. I could tell many, many stories from working in healthcare where it's devastating for families sometimes when they don't know this. They think, oh, I have health insurance. if, you know, they have a family member that needs to be in that type of facility, receive long-term care, and they get shell shocked when they realize they're only going to pay for 15 days. You know, what are we supposed to do? And I've seen it, unfortunately, you know, drain people's savings, their retirement accounts. Have you ever run into that, Angela, like working with people?
Well, I just seen, I had one client that was about to, um, cancel her long-term care because she was trying to do her budgeting. And then I was like, that's probably not a good idea. And I think she was only paying probably 150 to 200 a month, and I think she said it would cover I think like 6 months of her income. And it also, hers actually helped replace her income. She was self-employed.
Yeah.
And so they would actually replace her income for a certain period of time and, stuff like that. So you are correct that that small amount that you're paying every month, because things happen, you know what I'm saying? And especially when you have a small business and you're the only person that is producing the income, if you have to stop, you need money coming in. So, I definitely agree that, getting a long-term program would definitely help. Because I know when I was an employee many years ago, and I I had a high risk pregnancy, of course, with the twins. And so I had to take some time off, and just being able to have that medical leave really helped me a lot because I was having money coming in. And so as a business owner, we kind of have to take care of these things on our own to make sure that we're good, because we don't have an employer that's keeping us together and stuff like that. And but I was gonna ask you, because I know in your presentation a while ago you mentioned cancer care. So like if somebody they was healthy otherwise, but now they have cancer, and you guys have a program for something like that.
Yeah, absolutely. Again, it's like one of those topics that people never want to think about or talk about or go there mentally. But yeah, as long as someone has already been a member of like a health sharing plan, if they get cancer, or people that have strokes and all kinds of ALS is another one, just like a debilitating disease. If people get diagnosed with things like that, and they have to receive, chemotherapy, radiation, surgery, all kinds of other treatments. Oncology treatment is some of the most expensive out there. It is so expensive. Same type of thing. If people don't have health insurance or any type of share plan in place, like I've seen that financially just devastate people. And that will be covered as part of anything else. Again, if someone has cancer, it's going to be difficult to get on an insurance plan. It's going to be difficult to get on you're definitely probably not going to be able to be on a health sharing plan either, for sure. But as long as they already were, they're set, they're good to go. All those bills will be processed just like anything else, doctor's visit. It's the same system. And so again, a lot of what I do is educating people. Don't wait, just like anything, don't wait until you need something to reach
Yeah.
out. I unfortunately, I got a text at 2 a.m. a couple weeks ago. I need healthcare coverage. And I'm thinking to myself, okay, I really pray this is not from someone that's in an ER right now. Because unfortunately, people don't, there are a lot of people, millions of people that still don't have any type of health insurance in place. And that's a really, really scary place to be. So I always tell people, get it, kind of like what you advised your client about the long-term care thing. I'm so glad you did, because people never think that they're going to need it. They never think they're going to be part of the group of people that has a life-altering event medically, and to have something in place is everything.
And with group insurance, I think you probably already answered this, that, it just has to be for under, um, 50 employees. Do you know the requirements for health insurance for, employees, for employers and stuff?
Yeah. So for healthcare sharing, anything, 49 and under, full-time employees, full-time W-2s, that is where that's kind of our sweet spot when we work with companies, because there's no government mandate, there's no like minimum health insurance coverage that the employer is actually mandated to offer. So that's why like health sharing is a really easy fit for any companies that are 50 and over. This is full-time employees or like full-time equivalents, W-2s. That's whenever they have to have some type of health insurance plan that's offered. So when we still work with employees over 50, we're working with companies right now that have over 100 employees. Sometimes it's half W-2s, half 1099 contractors. So that changes things too. But when that's the case, we just come in alongside a health insurance broker, and we just present and say, hey, this is also an option for anyone that's healthy and would want to look into this. That typically happens, during open enrollment. It starts here in 14 days. So this is really the busy full season, not only for health insurance, of course, but healthcare sharing, because they're looking at, what other plans can I get? Sometimes people are shocked at the cost of health insurance. It went up, maybe hundreds of dollars a month from last year. And that's really where we do a lot of the group presentations and the group work is right now. A lot of, July and then August, September, really even through January, toward the end of open enrollment is where we get to work with groups. But anything under, 49 full-time, we can be the only option they offer if they want to. Anything over that, we have to come in with a health insurance plan because they're mandated to give that to their employees.
Okay. So if somebody was interested in working with you guys, actually go and talk to like just the, owners, or you kind of talk to explain everybody at the company?
Yeah, so we do both. It depends on what the owner prefers. You
Okay.
know, a lot of, as you know, Angela, I'm sure you've seen all kinds of the numbers with the healthcare coverage for owners. Sometimes, like if it's a family business, they have like a family plan. It's not even run through their business, and
Right.
it's coming out of their personal account. That's a situation. Sometimes it's a a big company, or maybe let's say a medium-sized company. They've got 100 people on their payroll, but maybe 80 of them are 1099s.
Yeah.
Technically don't have to offer any type of health insurance.
Right.
So if I'm trying to think too, like a real estate team, for example, that's technically, they're all under whatever real estate brokerage they're with, but they
Yeah.
they don't really typically have benefits options. They're kind of on their own. So everything's different. A plumbing company, a roofing company that has 10 people, 10 employees, maybe they do have a plan. So sometimes business owners, the healthcare it's very different from company to company. So depending on, typically if the owner is already paying insurance, they're heavily involved in the process with us because we right away give them quotes. If they like the numbers, which most people do, it's typically, 50 to typically 50% cheaper than health insurance. Business owner gets excited about that number, but we want to again make sure, and they want to make sure that it's going to be the right fit for their employees. It's not going to be probably for every single person, which is where we then come back after we have the interests of the employees, the people that like the plan, that are excited about it. We then readjust the quote, show the business owner, this is what you'll pay with us. These are the other people that want an insurance plan. It still, saves the business owner a lot of money, and it's good for all the parties involved. That's one process. Another, I went, as an example, about 2 weeks ago, I went and presented to a real estate team. There were a bunch of people there. Some of them were realtors, some of them were agents, some of them were just like salespeople for the brokerage. They all are pretty much their own contractor. And so a bunch of them, they came up to me personally And I was able to do multiple, family plans for those. Those were all separate accounts. So it really depends on the business owner and what they already have in place. We typically do, we kind of roll over a similar situation when the share plan comes in. For family businesses, we see this a lot. I just worked with a painting company. It's a really great family business, but there's quite a few of them. They're cousins, they're second cousins, the spouses of the children and the grandkids. And it's an amazing company. But they all were on basically a couple family plans.
Yeah.
We set kept the same similar thing, and rolled over the people that were interested in the share program. We gave them that and then kept the other people on insurance. So it really depends on what the person already has in place.
Okay, cool. Is there anything else that you think that everybody needs to know today?
Yeah. I would say, you know, a lot of people right now are looking for ways to, increase income in their family and alleviate expenses, kind of like your client. And unfortunately, sometimes people, if they are paying for things like long-term care, that they forget why they're paying for it. It can be tempting to just try to save the most money possible. And so sometimes when people see the savings that a share program can offer, they get a little nervous because they're thinking, well, this is half the cost of insurance. Like, surely there's a problem here. Like, what's going on? And so sometimes it works against sharing a little bit because it can raise a little bit of skepticism. Why is this so inexpensive? But unfortunately, people are forgetting that healthcare is extremely for profit. Insurance, and pharmacological companies, and there's a lot of money that's being profited. And unfortunately, people that are sick in hospitals on prescriptions, there's no money in keeping people healthy. There's a lot of money in keeping people sick. And so the thing that I would share with everyone, whether you're live or watching the replay, is be open-minded to all kinds of alternatives. We get to work with naturopathic doctors. We get to work with people that they are, medical doctors. They went to medical school, they're licensed, all of that. They have practices, but that they also, for clients that are wanting to maybe heal their bodies naturally, or they want to look into like herbal supplements and different things, red light therapy, whatever that may be. The doctors that really adapt to that, we've seen a ton of people bounce back from illnesses and become healthy because that doctor was open-minded and it really helped them. And so I would say the same thing for people is be open-minded when it comes to healthcare sharing. It's not just cheaper. It's not just a less expensive health insurance option, but it's really, really great. People don't have a network. I didn't really talk about that a lot, but people can choose the doctor they want to go to. That's a really, really big value point when it comes to health sharing. Is it's really, really empowering for those that it's a good fit for to be able to choose the doctor or the hospital system or wherever they go to receive medical care. You get to choose your realtor, you choose, your accountant. Angela's amazing, guys. You choose all the people, your barber, like you choose everyone that you do business with. And so people love having the freedom and the ability to choose the people that they're trusting with them and their family's healthcare. So just be open-minded, reach out to people in the industry, reach out to me. There's so many knowledgeable, amazing people that can help educate more about health sharing and see if it's a good fit. But it could be the difference between, a lot of money and a lot of just time saved from headaches and trying to figure out the craziness that can happen with healthcare issues that come up. There are people that are really genuinely, and companies that are really genuinely just looking to pay people's medical expenses, to do good in the world, and to help as many people as possible.
And something you said reminded me of another thing you said. With the insurance being so high, a lot of that has to also do with medical care, giving the insurance higher, um, prices. And I think you were saying that with the health sharing, y'all actually can negotiate the pricing, and that's another reason that you guys can keep um, your costs low, because you're able to, get them to give you the actual price of what things are supposed to cost.
Yeah, absolutely. I mean, the cost of anything, whether it's a toothbrush that someone needs to use in the hospital, or a couple ibuprofen, or a pillow if they want an extra pillow for their bed, or if whatever it may be, like people don't realize that they're paying for all that, and they're paying a way over inflated number versus the actual cost. And so if you guys have ever heard of like being able to negotiate your medical bills, a lot of people don't know, but that is the thing, whether you're with a share program or not, like you can push back and say, I want an itemized receipt. You can ask for that stuff. And sometimes, companies will threaten, like, we're going to send you to collections and all that kind of stuff. But people, there's a whole realm out there that you can study and research that people really do have more power than they realize to kind of put their foot down and say, no, I want to see a breakdown of what I'm paying. You guys are giving me this number. Maybe it's $10,000 for an ER visit. Why? Let me see the breakdown of all of it. And they can negotiate that. And a lot of sharing groups, the company I'm with as well, they'll negotiate, like you said, Angela, all of that bill on behalf of the member. So the no network restrictions and that aspect, the repricing, in addition to the lower premium cost for people that are healthy, it's a bit of a no-brainer. And Angela, if you don't mind, I'd love to ask you a couple questions if we have time. I'd love to throw it back to you guys. Angela is extremely humble. I mean, her and I have gotten to do business together, and she really is an expert when it comes to working with car dealerships. And first thing I wanted to ask Angela was to just tell us a little bit about your background. Like, what made you choose accounting? And how long have you kind of been in the space of bookkeeping?
So I was kind of nurtured into this. So like my grandmother, she had a store out of her house, and she had me to handle the inventory. I would tell her when she needed more inventory, chips, pickles, keep her updated on what the customers were asking for. They wanted hot sauce and, different things like that. So I was about 8 or 9 years old at the time. And I had no clue that it was called bookkeeping, but that's what she had me doing. And I would count the money compared to the inventory to see how much money she actually made, and provide her with that report. And it was just handwritten information. So I would give her daily information or whenever she needed it. So that was my beginning, and I really enjoyed it. And so we moved to Texas, and my dad started a church. And when he started doing, selling candy and stuff, then he had me in charge. So that was my next step. And then at 16, when I got my first job, my dad made me do my own taxes. So,
At that
and
point, you're like, I've done this for so long. This is a breeze.
then my siblings, he told them to do theirs too, but they just gave it to me. So, I was doing everybody's taxes at 16. And then about 18 other family members were like, can you do my taxes too? So, and it's something that I really enjoy, but I tried to deviate though. When I got to college, I decided to go for architecture. And, I had fun doing it, but I ended up getting pregnant, and architects have to travel a lot.
Yeah.
So I was like, well, I guess I gotta go back to trustee accounting. And so sometimes fate just, you have to go the path that you are destined to be in. So I went back to school for accounting, and I really have enjoyed this profession. It's like a passion for me. It feels like a hobby, to be honest. Like, you know how they say if there's something you can do for free, then, if I didn't have bills to pay, I really would be doing this for free because this is something that I enjoy. It's like doing a puzzle, especially when I have clients with very complex situations. It just brings me joy. And I know a lot of people are like, really? But it does, especially once I solve the problem. It's like completing the puzzle. So I really enjoy what I do.
That's amazing. Angel, what an awesome story. I didn't even know that's how you originally had gotten into everything. So I'm like, that's incredible. And I love what you said about, it's I would do it for free, and you literally were. That was your roots. So that's awesome. And tell me about, what made you choose like the working with companies rather than doing like personal accounting, and focusing. I want to know about that first, and then I'll ask you about car dealerships. But what drew you to businesses and owners?
So businesses have more complex situations. I did have one client. I loved her dearly. She was like an elderly client, and it was very important for her to keep her register and everything separated because she does do a lot of deductions, at the end of the year, and she wanted to make sure that everything was going to be accounted for. So that was fine. And every now and then I might take a personal client. But for the most part, businesses have a bigger need for someone to come in and keep all their books and stuff straight. And especially as the business is growing, some things can get out of hand. Like I had a client that had been in business for 20 plus years, before I came in with her. And a lot of people look at companies and they're like, oh, they're doing good, they know what they're doing. Well, when I came in, um, the owner had no clue about her financial standing in her business. And the bookkeeper kind of just handled everything. Like all the information and everything was under the bookkeeper's name. And so when I came in, we had to prove that my client was the owner of the business so that we can kind of, transfer for me to be able to, help her. Like she couldn't even barely talk to the IRS because who are you? You know what I mean?
Wow.
And so when I started with her and our first meeting, when I gave her a monthly report, she was like, I've never done this before, and I was, meeting with her monthly to show her her income and stuff. And she was like, oh, this is helpful information, and she was able to make managerial decisions about her company that she had never done before because she was just working. And
Wow.
she would just look at the bank account. Okay, I have money today. You know what I mean? And a lot of people operate that way. And even with her account, I found just recently, we had parted ways and then came back together. And recently I saw on her statement, a lot of people get alerts on their phone for if a charge is over $1 or something like that, right? Well, her account got hit for like 99 cents over the course of like months, right? And it wasn't daily, it was like multiple times throughout the day, just
Wow.
random 99 cents. And I think it added up to at least about $4,000 or $5,000 over the course of time. But you would never get an alert because it's 99 cents, you know?
Oh my
And
goodness.
so if you actually have somebody like me looking at your information on a regular basis, then you can catch those things a lot sooner and keep you at bay. And then some clients give their employees a corporate card,
Mhm.
and a lot of them don't pay attention to what's coming out of those corporate cards. So businesses have a lot of risk that they don't even think about on the financial end of things. And, some of them think, oh, I can just do this in house. But when are you going to sit down and look at it? You know what I mean? So that's why I prefer the businesses over the personal, because the personal is just pretty much for information purposes only. But with businesses, this information is something that you can really do with, yeah. Right.
Wow. Yeah, that is wild. And I didn't even think about that under $1 expense. I could see that. That's craziness. Talk to me, Angela, about the transition from working. I mean, I know you've had experience working with so many different businesses to now car dealerships and being, so knowledgeable and have being able to help so many. Tell me about that transition.
Okay, so a friend of mine had started working with car dealerships, and he was bringing me along to kind of make sure that they was treating him right, in the industry and stuff like that. So that was in 2020, and that was my first experience with anything with car dealerships. So I would, communicate with the owner, quite a bit, and I learned a lot about the different regulations that are required. And unfortunately, the two dealerships that he tried to work with ended up going out of business because of a lot of different, safeguards. And that's why I wrote that ebook, because I was like, these are things that a lot of people don't think about, and keeping up with them could be difficult, especially if you're a one-man band. You know what I mean? And so I finally told him, I was like, you know what, why don't you just do your own thing and I can help you out with this? And so with that, I had to learn a lot. I did the dealership training course that you have to take for Texas. And as I'm going along, there's different things that I'm learning. I attend all the trainings that the county offers. And I know that it's a whole lot, and like I said, challenges are my favorites. And car dealerships is probably the most heavily regulated industry in the United States, and one little mix up could cost you thousands of dollars with this industry. And so I would really love to be part of helping my clients to maintain those things, and also expenses get out of control, especially like when you're buying inventory for used cars. You hope that you are told everything wrong with it ahead of time, but as we all know, when you drive your own car, you think you fixed something and then something else is going on. So just being in the used car industry, you're spending a lot of money on things, and so you don't even know until the numbers are put together, and you're like, man, I spent that much money on that car. And if you're selling this car for a certain amount and you don't know how much money you put into it, you could be losing money. So, so that's why I really love working with this industry, is because I get to provide my clients with information that helps them to make the most money that they are able to make, and make those decisions. Because sometimes they might be like, okay, I don't spend too much. Let me just throw this back in the auction and see what I can get for it, because, it's becoming a money pit. So it's just so much that if you don't know, you don't know. And the financial aspect of businesses usually get put on the back burner. And this is something that needs to be known up front. And so after you done worked all day, sold cars and stuff, nobody wants to go home and put together this type of information. So that's why I really just want to team up with them, and kind of give them a little peace of mind, so that they know that when they get to work in the morning, they can look at a clean report and know what they need to do for the week or the month or the year or whatever the case may be. So.
That's amazing. And I know you have a ebook out. I heard you briefly mention that. That was my last thing I wanted to ask was where can like car dealer ownership or owners find that ebook, and also just any of us, where can we find that? Do you have a link, or
Yeah.
talk to us more about that?
Okay, so yes, I have a link. It's Angela J. Owens facebook.com/5mistakes, because the 5 mistakes dealerships make that could put them out of business. And it goes over the top 5 things that people really don't think about with the regulations and timely information and keeping the inventory fresh and different things like that. Because sometimes they don't even know their inventory turnover rate, and it's important to move those cars pretty fast in order to make money and stuff like that. So, yes, the ebook would definitely be a great start, and anything that I mentioned in there, I could definitely personally help with implementation. I help clients to get workflows, processes. What I try to do is help clients to do as much as possible to make the accounting not as burdensome to them, so that they can have good data on a regular basis without having to go out of the way that they operate. So
Amazing. Well, that was those were, I mean, I have many questions, Angela, I could ask you, but don't want us to be on here for hours and hours for all the viewers. But thank you again so much for having me on today. You were just a great friend of mine, and I love doing business with you, and just really thankful that we got to do this today.
and thank you, and I'll definitely be bringing you on again and give us some more information, because everybody needs to know about this. So thank you so much.
Of course. Thank you so much. Have a great day.
All right, you too. Bye.